The public dental healthcare system in Australia operates under a fee-for-service funding model which incentivises volume rather than value. People who access the public dental system are generally more disadvantaged, have more oral disease and fewer teeth, and are less likely to access services than the general population, and more often than not have to wait over a year for treatment. To address inequities and improve health outcomes, Dental Health Services Victoria implemented a novel, co-designed, patient-centred, value-based healthcare framework. A new model of service delivery was implemented, with all patients undertaking an oral health questionnaire and oral health coaching prior to any clinical treatment. The oral health questionnaire includes the ICHOM Oral Health Patient Reported Outcome Measures standard set. Patients' overall risk score is calculated from the patient's responses to the questionnaire, and an appropriate care pathway is determined. In this way, instead of patients being placed on a wait list with a first on, first off process, those patients most in need can be prioritised for care. All patients then participate in a group or tailored one-on-one oral health education session to improve their health literacy and to commence their self-management journey. Compared to the standard general care clinic, the value-based healthcare model showed 44% lower failure to attend rate and 36% higher prevention service utilisation. A higher proportion of clinicians worked to their top of scope of practice. Approximately 80% of services previously provided by dentists were shifted to oral health therapists and dental assistants, thereby releasing the capacity of dentists to undertake more complex treatments. Adopting a co-design methodology has enabled patients and clinicians to become shared decision makers in achieving value and driving improved oral health outcomes. Our initial assessment showed that value-based healthcare was more costly. However, this was due to upfront implementation costs and ongoing training. Over time, there has been a stabilisation of costs due to reduced variation, appropriate workforce skill mix use, automation of processes, and producing better health outcomes. We have influenced, engaged, and led the uptake of value-based healthcare among our 50 community dental agency partners across Victoria, including the broader healthcare sector. Our value-based healthcare framework can be extrapolated to any health discipline. By sharing our learnings, reflections, and knowledge, we have inspired several organisations to adopt the principles of value-based healthcare and maximise value for their patients and clinicians. Taking an incremental approach to implementation by starting small, demonstrating success, and scaling up has allowed us to build the necessary support systems, momentum, and bring patients and clinicians on the journey. Building the foundation blocks that can be scaled has been the cornerstone of our success.